Okay, everybody. Thank you so much for joining us today. Gonna go ahead and get started. And let me get ready here. Okay. So if you could go to the next slide, please. All right. So good afternoon, everyone, and welcome to the Elimination of Assets for Non-MAGI Medi-Cal Advocate webinar. Great. So I want to thank everyone for joining us today. So for those of you who don't know me, my name is Sarah McDonald. I am a health program specialist here with the Medi-Cal Eligibility Division here at DHCS. And I am the lead for the Asset Elimination Implementation Project. And we are excited to have you all here today and excited that we are almost to the finish line of this implementation. So today, the webinar is going to provide some background information on the elimination of assets for the non-MAGI Medi-Cal programs. And we'll discuss the policies impacted by this implementation. So just some housekeeping reminders for everyone. We have enabled the Q&A functionality to enable you to ask questions. If we do not respond to your question during the webinar, we will provide a response via a Q&A log, and the log will be posted to our Asset Limit Changes webpage. Also, today we have a live Spanish interpreter, and therefore I'm going to be speaking a little bit slower and pausing between slides to allow for a more seamless interpretation process. Okay, so now let's get started.
Sarah, we can't hear your audio.
Sorry, I believe I'm having some technical difficulties.
We can hear you now.
Okay,
There we go.
thank you. Sorry, I'm not sure what happened. Okay, so we're going to go ahead and move to the next slide. Okay, so first off, some quick background information on asset elimination. So Assembly Bill 133 was signed into law by the governor on July 27th, 2021. This law included a two-phased approach to eliminating the asset test used to determine eligibility for non-modified adjusted gross income, or non-MAGI, Medi-Cal programs. Phase 1, implemented on July 1st, 2022, increased asset limits for all non-MAGI programs up to $130,000 per individual and $65,000 for each additional household member up to 10. Phase 2, which will be effective on January 1st, 2024, will eliminate the asset test entirely for all non-MAGI Medi-Cal programs, which includes long-term care and Medicare Savings Programs. Next slide. So this slide discusses some information on the different non-MAGI Medi-Cal populations. So non-MAGI Medi-Cal is made up of a variety of programs targeted at specific groups of people with certain attributes and income levels. Some people who do not qualify for a modified adjusted gross income or MAGI Medi-Cal may qualify for a non-MAGI Medi-Cal program. The following individuals may be eligible for non-MAGI Medi-Cal. Persons under 21 years of age or 65 years of age and older. Individuals who are blind or disabled. Individuals residing in long-term care facilities or nursing homes. Families with children under the age of 21 who have too much income to qualify for MAGI Medi-Cal. And pregnant persons. Okay. Let's move to the next slide. So next, I wanted to provide some information on individuals who receive their Medi-Cal through the Supplemental Security Income or SSI program. The Social Security Administration administers the SSI program, and SSI recipients are automatically eligible for Medi-Cal through this program. The elimination of assets does not apply to individuals who receive their Medi-Cal through SSI, as SSI uses federal criteria for program eligibility. Okay, next slide. So retroactive Medi-Cal. Medi-Cal applicants can request retroactive Medi-Cal coverage for up to 3 months prior to the month of application. Individuals who apply for non-MAGI Medi-Cal programs prior to January 1, 2024 will still be subject to the current asset rules. So as a reminder, the current asset limit is $130,000 for an individual, and an additional $65,000 is added for each additional household member up to 10. Okay, next slide, please. So stakeholder engagement. So DHS is using existing stakeholder engagement forums to discuss and provide updates on asset elimination implementation, which includes, but is not limited to, our Asset Elimination Stakeholder Work Group, the Consumer Focused Stakeholder Work Group, or CFSW, and the County Welfare Directors Association of California, or CWDA meetings. Okay. Next slide, please. So the following slides are going to discuss different policy areas and how asset elimination will or will not impact them. And first up, we have information on the Medi-Cal Estate Recovery Program. So policy guidance regarding estate recovery is found in Medi-Cal Eligibility Division Information Letter, or MEDL, I-23-39. And as outlined in the MEDL, there is no change to the estate recovery rules or the process in which funds are recovered due to asset elimination. Counties will not request any asset information from applicants or current Medi-Cal members for purposes of estate recovery. For any specific questions regarding estate recovery, please reach out to the DHCS Third-Party Liability and Recovery Division. And on this slide, we have their website at the DHCS website, along with their email for their dedicated inbox and their dedicated telephone number. Okay, next slide, please. And now we're going to move on to our section and discuss income-producing assets. Policy guidance is located in all County Welfare Directors Letters, or ACWDLs, 23-20, ACWDL 23-21, and ACWDL 23-22E. Assets that produce income are annuities, individual retirement arrangements, or IRAs, retirement plans for self-employed individuals, or formerly known as KEOs, work-related pension funds, income from rental property, interest and dividends, and trusts. Okay, next slide, please. And now we have some information regarding annuities. So effective January 1st, 2024, the undistributed balance of an annuity is no longer considered in the non-MAGI Medi-Cal eligibility determination. Any payments received from an annuity will continue to count as unearned income according to 22 California Code of Regulations, or CCR, Section 50507. Individuals are no longer required to take periodic distributions from the annuity as a condition of Medi-Cal eligibility. Next slide. And now for information regarding IRAs, retirement plans for self-employed individuals, and work-related pension plans. So as of January 1, 2024, the cash value of these plans are no longer a factor for non-MAGI Medi-Cal eligibility. Any payments received from these funds will continue to count as unearned income according to 22 CCR Section 50507. Individuals are no longer required to receive periodic payments from these funds as a condition of Medi-Cal eligibility. And these funds are also not considered unconditionally available income. Okay, next slide, please. Okay. So next is information regarding income received from rental property. As of January 1, 2024, property utilization requirements under 22 CCR Section 50416 and 50427 are no longer required, as the underlying property is no longer a factor in the Medi-Cal eligibility determination. However, the net income received from the rental of real property will continue to count in the Medi-Cal eligibility determination and is calculated in accordance with 22 CCR 50508.
I think your sound may have gone away again.
No, we can't hear you.
How about now?
Yes,
Perfect.
thank you.
Thank you. Sorry, guys. Technical difficulties aplenty today. All right, we're going to move on to the next slide. Interest and dividend income. Okay, so effective January 1, 2024, there is no change to the treatment of payments of interest and dividend income for the purposes of non-MAGI Medi-Cal eligibility. Interest and dividend income is unearned income under 22 CCR Section 50507A, 19, and 20, unless there is a specific exclusion. For additional information regarding interest and dividend income, please refer to ACWDL 23-21. Next slide. And now for treatment of trusts. So effective January 1, 2024, trust principle is disregarded for purposes of Medi-Cal eligibility. Income rules regarding trusts have not changed. For additional information regarding the treatment of trust income, please refer to ACWDL 23-22E. Okay. Next slide, please. So spousal impoverishment provisions. So effective January 1, 2024, the Community Spouse Resource Allowance, or CESRA, will no longer apply. Income eligibility for the SI provisions will remain unchanged. DHCS will continue to publish annual guidance regarding the minimum monthly maintenance needs allowance and the average private pay rate. For individuals who are seeking the application of SI provisions prior to January 1, 2024, current SI property policies will apply. For more information regarding spousal impoverishment provisions, please refer to ACWDL 23-16. And next slide, please. And now for information regarding transfers of assets. So for transfers of assets made on or after January 1st, 2024, they will not be reviewed for purposes of Medi-Cal eligibility. Counties will not request verification of transfers or calculate any periods of ineligibility. And again, that's for transfers made on or after January 1, 2024. Now, next slide. Now, transfers of assets made prior to January 1, 2024 will continue to be subject to the transfer of asset rules, including periods of ineligibility. Transfers of assets made by an individual applying for long-term care or a current Medi-Cal member or their spouse seeking long-term care services will continue to be reviewed in the look-back period prior to January 1, 2024. For additional information on transfers of assets, please review ACWDL 90-01, sections 50408 through 50411.5. On January 1, 2024, the look-back period is the 30 months prior to January 2024. The number of months that must be reviewed in the look-back period decreases by 1 month for each month that passes after January 1, 2024. Next slide, please. And now I'm going to turn it over to Bonnie Tran, who's also from the Medi-Cal Eligibility Division, to discuss the Outreach Materials Resource Hub.
Hello, my name is Bonnie Tran with the Department of Healthcare Services, and I will be presenting on the Outreach Materials as well as Resource Hub. Next slide, please. So currently we have over 4,000 DHCS coverage ambassadors who are signed up to help DHCS spread the word on the continuous coverage unwinding efforts. So if you have not signed up to become a DHCS coverage ambassador, I highly encourage you to join in order to receive the latest updates as well as have access to all of the resources that are available. I also wanted to remind everyone that we are holding webinars for the DHCS coverage ambassadors every other month. So sign up to make sure you get this information. We are also sending out emails every 2 weeks with updates to include any new outreach materials that have become available. Next slide, please. So this is the Keep Your Community Covered Resources Hub. We launched this to support the collaboration in this effort. The Resource Hub is a one-stop shop to download and share all of the latest communications resources that we have available. These resources were created based on feedback from navigators, ambassadors, as well as community partners. This Resources Hub is updated regularly with the latest and ready-to-share resources in all 19 threshold languages. There are sections once you visit this page for each language and the tabs for each section for the different types of resources that are available. Next slide, please. So social media graphics. This is some of the resources that you can find in the social media graphics tab. You can directly share the post to your channels from the Resources Hub, or you can also download the graphics along with the Word document that shows each graphic and its accompanying post copy. And I just wanted to note that the sharing function is only operational for English and Spanish, and this is to avoid translations from losing integrity when shared in languages that do not use the Latin alphabet. But all of the language are available for download and for sharing. Next slide, please. So there are also print materials that are available. We have customizable flyers, posters, as well as palm cards that are available in all of the languages. And there are also posters that are available, so you can print these out and have them available. Most of these files that we have, such as the flyers, allow for customization, so you can add your own logo as well as your organization and any contact information that you would like to put on there, such as phone numbers or addresses. So in order to customize it, there's a little text box on the flyers where you can click on and add your information there. So once you add that information, you can save it and print it out with your information on there to share. Next slide, please. We also have videos that are available, and so these are detailed how-to videos explaining step-by-step renewal processes. And this is perfect to play in lobbies or waiting rooms that have like a TV or something available for you to show those. We also have short videos that are made for social media, as well as this is what we use for advertising. The how-to videos are available in all of the threshold languages, so you can share the one that you choose, or you can download it and share it on your own platforms. All of these videos, some of them we have used in our advertising campaign, but you can download the videos and upload it to your social media platforms, or you can share it from our YouTube. Next slide. So we have a lot of tailored audience resources that we have created. So we have materials that are available for in-home supportive services, as well as managed care plans. And we also have materials that are targeted for providers, schools, and families, as well as older Americans that are on Medi-Cal. All of these resources include key messages, as well as frequently asked questions, and at least one customizable flyer that you can use. All of these also have at least one social media graphic that you can share on your platforms. And we also include messaging that you can use for emails and text messages, or text that you can put on your website. Next slide, please. So these are just some of the social media graphics that we have available that you can download to share on your platforms that are tailored to asset elimination. You can download these, or you can share it directly from the resources hub that we have available. There are different options to choose from, so you can choose the one that best fits your need. Next slide. This is just one of the customizable flyers that we have available. So if you look on the bottom right corner, there's a little box where you can click on and add your information. So you can customize this and put your organization name, as well as your address and phone number, or website, just to have contact information there. And so you can save it once you put in your contact information, and then you can share it on your website as well as other platforms, or you can print it out and have it available in your lobby or office. Next slide. And these are just some resources that we have, pages that you can bookmark. The first one is the link to our webpage. The second link is a link to the resources hub. And we also included the 2 member-facing pages that we have here. These are links that you can share with your Medi-Cal members, and this is where they can find information, frequently asked questions. So if they need information on what they need to do after they submitted a renewal form, or things like that, they can find all of that information here. So these are directly tailored for Medi-Cal members. Now I will turn it back over to Sarah for the Q&A session.
Thank you, Bonnie. Next slide. Nope, you're good. Sorry, that's the right slide. So for after this webinar, if you have questions regarding the elimination of assets, please feel free to reach out to our dedicated inbox, which is assetlimitchanges@dhcs.ca.gov. And now we're going to make our way through the questions we received in our Q&A box. Just a reminder, if we don't make it to your question, these questions will be posted in a Q&A document on our Asset Limit Changes website. And also a recording of the webinar will be posted to that website as well. I know that was a very common question that we were receiving, so hopefully that answered all of your questions for that. Okay.
Sarah, did you want me to go ahead and read out some of the questions?
Yes, please.
Okay, first question is wanting to confirm the impact of the asset elimination on spousal impoverishment. Does this mean that DHCS will no longer be placing liens or recovering the cost of LTC services when the home is sold? Sounds like this might actually be referring more to estate recovery rather than spousal impoverishment. Liens and recovering the cost of long-term care services is going to estate recovery. And as we mentioned in the presentation, there are no changes to those rules. The department will continue to follow the existing estate recovery rules. And then the changes to spousal impoverishment are just on the property eligibility side. There will no longer be a property eligibility component when applying the spousal impoverishment rules. All right. Next question. Is about the approval process. My understanding is that the federal government granted a waiver to California to eliminate the asset test for Medi-Cal. Is there a chance a future administration will rescind the waiver and force California to go back to the original income limits? Did you want to take this one, Sarah?
Sure. So we actually received permission from the Federal Centers for Medicare and Medicaid Services to eliminate the asset test for non-MAGI Medi-Cal. And we received that permission and updated our state plan amendment to enforce these changes. The only portion of this change that required a waiver was for the very small population of deemed SSI individuals. So this is individuals that are in the PICL, Disabled Adult Child, and Disabled Widowers program. So it's a very, very small subset of the non-MAGI population that we received a waiver for. And the waiver has to be renewed every 5 years. And also the state plan amendment is to update the asset test to eliminate it. The income limits have not changed. The income limits and income requirements remain the same for non-MAGI. As for if a future administration will make changes, unfortunately, we cannot predict that, hoping that that won't happen. Brooke, I'm not sure if you have any additional information you'd like to add there.
I'll just add that the change originates by a legislative change to state law, as we started the presentation with, and then we seek the federal approval based on the new state law. And so we don't anticipate that this would not be a permanent change to our policy.
Thank you.
All right, next question. I'm confused by the list of those eligible for non-MAGI. Pregnant persons are eligible for MAGI Medi-Cal, and children under 21 are eligible for MAGI. Why are they on the list?
Brooke, I don't know if you want to take that one.
You're correct that these groups, pregnant persons and children, are typically eligible under our MAGI programs. But prior to the Affordable Care Act, they received their coverage under non-MAGI Medi-Cal or traditional Medi-Cal programs. And so we do still offer eligibility for them under non-MAGI Medi-Cal if they are not eligible under MAGI. But they are evaluated first for MAGI eligibility, and then if ineligible, they could have eligibility under non-MAGI as well. So they can be evaluated for non-MAGI in addition to MAGI.
Thank you, Brooke.
Let's see. If somebody applies for Medi-Cal in December 2023, but they are over the current asset limits, will they be approved for Medi-Cal starting January 2024, regardless of assets? So the earliest people can apply with no asset limit is next month.
Yes, that is correct. If an individual applies in December, they will automatically be reviewed for their eligibility in January. So if they're over for December, they would be denied for December, but the county will look prospectively at their eligibility and grant eligibility going forward.
And then there's a request to kind of review the portion regarding retroactive benefits. How far back can benefits be retroactive?
Sure. So retro benefits are available for the 3 months prior to the month of application. So say someone applies for Medi-Cal in December and they request 3 months of retroactive benefits. So we would look at their eligibility for November, October, and September. So if someone applies for Medi-Cal in January under the new rules of no assets, we wouldn't look at assets for that month. But if they are requesting retro, then we're going to look at their eligibility under the current rules for December, November, and October when there is still the asset requirements.
And I just wanted to point out a few people asked for a link to our asset limit webpage. And so that has been placed in the chat if folks are looking for that. And then it's also in the presentation, I believe, as well in the slide deck. Then we have a question for parents older than 69 years old who would be non-MAGI eligible. Does this mean you do not need to worry about things like life insurance, traditional IRAs as assets, but withdrawals from the IRA would count, or required minimum distributions would still count against them? Does it look at current year income or previous years?
Yes, that is correct. So for individuals that have instruments such as life insurance, we will no longer look at that. And for those who have IRAs, we will no longer look at the balance of the IRA, but we are going to look at the money that they receive from the IRA. So if they're receiving RMDs, we're going to count those RMDs as income in their non-MAGI eligibility budget. So non-MAGI looks at current income, income in the month that it's received. So if they're receiving an RMD of a certain amount in each month, we're going to budget that amount that they receive.
That was a good question.
Yes, a very good question.
And that goes to the next question, which is, will assets no longer be needed for those ages 65 and older in 2024? So that is correct.
Yeah, and also to add to that, our non-MAGI population, although very typically it serves our aged over 65 population, but it also serves our disabled and blind population. And sometimes those individuals are under the age of 65. So those people are included in the elimination of assets as well.
And then will DHCS be creating flyers on the new asset requirements for beneficiaries?
Yes, DHCS has worked with our communications vendor. The name is GMMB, and a flyer is being or has been sent out to all Medi-Cal beneficiaries, informing them of the new changes. We also have some other information that is on our asset limit changes website. There's links there where you can go to find information about the changes that you can, counties can use, and that our other partners can use to get the information out. But yes, DHCS did create, or with help of GMMB, to send out that information to our beneficiary population.
And then there was a request to give an example of the transfer of asset rule after 1/1/2024, wanting confirmation that the look back period is 30 months and that would be the farthest back that we would look back after January 1, 2024. And then that the look back period would decrease after 1/1/2024. That is correct. There's a really good, I would point everyone to the ACWDL that will be coming out soon. We're going to be publishing a transfer of assets ACWDL where we go over the look back period, and we have a chart that illustrates how the look back period will decrease with time, and have a chart of based on when the individual applies, what months the county will need to review the transfers leading up to 1/1/2024. And so look forward to that letter coming out very soon.
And Brooke, I also actually got the ACWDL number assigned for that letter. So it will be ACWDL 23-28. So look forward to that in the next several days.
You heard it here first, latest and greatest. Okay, let's see, next question. Will the client still need to provide bank statements when applying for Medi-Cal post January 1, 2024?
No, they will not. Individuals will not be asked to provide information regarding assets beginning January 1, 2024.
Bank statements however, can sometimes be used as income verification. So just keep that in mind, that if you are providing proof of certain income, then they can be used for that purpose.
Yes, thank you, Brooke.
And just wanted to let everyone know there is a link as well to the social media outreach materials regarding the elimination of assets, also in the Q&A, and that is available in the slides as well for people to download those materials. Question, is the rental of a room in your private home still considered income?
Yes, that is correct. That will still count as income in the Medi-Cal eligibility determination. I do not have the regulation for how that income is calculated off the top of my head, but yes, it still counts.
Are inheritances considered an asset?
Usually when someone receives an inheritance, it's received as a lump sum, and lump sum is considered income, which could be counted in the eligibility determination.
Yeah, it's a tough question to answer because we'd have to know specifically what they're inheriting. But if it is something like real property, then that could be more like an asset. But if it's you know, liquid, if it's cash, then it could be considered income. So we'd have to know more information to be able to accurately answer that question. It depends on what they're inheriting. There's a question, their understanding is that spousal impoverishment is no longer available in 2024. That is not correct. The spousal impoverishment rules are still available. Spousal impoverishment has an income component as well as a property component. And so applicants and current Medi-Cal members can still have the spousal impoverishment rules applied to their case and benefit from the income rules that allow for a monthly income allocation from the spouse that's in long-term care or receiving home and community-based services to the community spouse. And so there still is spousal impoverishment available. There's just not a need to do a property eligibility determination piece because we are not looking at the assets of the individual who's in long-term care or receiving home and community-based services. Will there be outreach to prior Medi-Cal applicants who were denied due to being over assets?
That is a very good question. And yes, DHCS, once January 1 rolls around, we are going to be locating all of the individuals who were denied for exceeding the asset limits in the 6 months prior to asset elimination. and we will be sending an outreach letter to them, letting them know that the rules have changed and that if they would like to reapply for Medi-Cal under the new rules, they can do so. So we plan to have those letters sent to those identified individuals by the end of February or early March 2024. I saw that there was a follow-up to that question. We will only be outreaching the folks who were, well, they were denied, but for exceeding the property. I do not believe we will be capturing the failure to provide folks, but we can certainly see if we can do that.
And here's a related question about individuals who apply in December. If they apply and receive a denial, do they need to reapply after January 1, or will their application be automatically reconsidered?
Their application will be automatically reconsidered. So what happens is that if they apply in December and are found to be over the asset limit, the counties will deny them for December, but they will look at their eligibility prospectively for January moving forward. So they'll only deny that 1 month of eligibility, but then grant them, barring that they meet all other requirements beginning January 1, 2024.
There was a question about IHSS and whether there's an asset limit for IHSS. And so IHSS is a Medi-Cal benefit that you receive if you are eligible for Medi-Cal without a share of cost, or if you meet your monthly share of cost. And so for non-MAGI Medi-Cal individuals, since there will be no asset limit for those programs, there's no asset limit for individuals who would be seeking IHSS. IHSS will be available to all Medi-Cal eligible individuals without an asset limit. Here's a question about lump sum withdrawals from an IRA. If a client receives a lump sum withdrawal of income, like $1,200 from an IRA, can they request to spread it out over 12 months as $100 per month of income? Lump sums are not allocated out over monthly. A lump sum like that would be counted one time in the month received as a lump sum, and it would only impact the income for that 1 month. Let's see if there's any others that we can answer in these last couple minutes. And I am seeing some questions that are asking about changes to income guidelines or income limits. Just want to emphasize that these upcoming changes in 2024 are solely to the property eligibility determination. So an individual who applies and are evaluated based on their monthly income, that eligibility determination will be the same. So if someone is applying to be in long-term care Medi-Cal and has a share of cost currently, that eligibility determination would be the same after January 1st. There's no changes to how that share of cost is calculated. This is solely a change to how much property or assets they can have and be eligible. Here's another question about changes to forms. Will the Medi-Cal application change on January 1st, 2024, or can we use the current application?
Yes, the current application can be used. The counties will know not to request or look at any asset information. Just so the audience knows, the Medi-Cal renewal forms have been updated to remove asset information from them. So individuals that are now receiving renewal forms for a January 1, 2024 renewal, they will not have asset questions on there. And I do know that the single streamline application does not have any asset questions on it either.
Okay, I think we have time for one last question, and then just want to let everyone know if we didn't get to your question, there's so many good questions here in the Q&A. We will put together a log of the questions and answers and get them back out to everyone. So don't feel bad if we didn't get a chance to answer your question here in the presentation. We will get answers out to everyone. I think our last question that we'll respond to here before we wrap up for the day is, let's see, I had it ready to go. What prompted these changes in asset elimination?
A bill was introduced into the legislature requesting the elimination of assets, and that bill was approved by the governor, which set forth the increase of the asset limits, which was effective last July 1st, so July 1, 2022. And then the second part of that legislation was the total elimination, which is effective on January 1st. And it is now 2:30 p.m. We thank everyone for coming today and attending this webinar. We hope it was beneficial for you. Like Brooke said, we will be compiling all of the Q&As that you sent in and posting a document to the Asset Limit Changes webpage where everyone can access the information. So thank you so much, and thank you for all of your partnership with DHCS on this implementation and spreading the word to our partners in common and our beneficiaries and applicants. We appreciate all of the help that you provide for us. I hope you have a wonderful afternoon and a great rest of your week. Thank you.